In the next few minutes, we'll show you how to use the AquaSeal to perform chest drainage and auto-transfusion procedures safely and with better results. Let's begin with chest drainage. As you know, there is normally negative pressure in the pleural space, the space between the lungs and the inside of the chest wall. When you breathe, that negative pressure allows the lungs to inflate as the chest expands. If that negative pressure is lost, the lungs may compress or collapse. A patient may lose negative pressure in the pleural space for a number of reasons, including trauma, disease, or surgery. The resulting conditions include hemothorax, when blood or other fluids accumulate in the pleural space; pneumothorax, when air accumulates in the pleural space; hemopneumothorax, when both fluids and air accumulate in the pleural space. If too much positive pressure builds up in the pleural space, it can cause a more serious condition called tension pneumothorax. If not relieved, this can result in a mediastinal shift. In all of these conditions, it's important to reestablish negative pressure in the pleural space. This will allow the lungs to expand and the patient to breathe normally. Underwater chest drainage using the AquaSeal system is the safest and most effective way to do this. AquaSeal is simple, reliable, quick to set up, and easy to use. Let's take a look at the AquaSeal chest drainage unit. The unit has 3 chambers. The collection chamber collects fluids draining from the patient's thoracic cavity. The water seal chamber acts as a one-way safety valve to prevent air from re-entering the pleural space. At the same time, it gives you an easy way to assess air leaks in the patient or the system. The suction control chamber regulates suction. The amount of fluid in this chamber controls the level of suction. Usually, the physician will determine the level of suction required. Generally, chest drainage begins during surgery, but most of the drainage happens after surgery while the patient remains in the hospital. That means you will be working with the AquaSeal while caring for your patient. We'll show you how to operate the unit in just a moment. But first, let's look at some of the new features incorporated in the new AquaSeal. Features that will simplify and enhance your management of chest drain therapy. The latex-free patient collection tube eliminates worry about latex hypersensitivity. It's also very clear, so you can check fluid drainage. And it's self-sealing, so you can easily collect fluid samples as you need them for analysis. AquaSeal's fluid level indicators are large and clear, so you can read them at a glance. The AquaSeal has adult and pediatric graduations. Incorporated into the unit is a new exclusive flow control valve, designed for easy one-hand operation. This unique feature provides quick and simple regulation of bubbling within the suction control chamber. The new WaterSeal access port provides safe, needleless access to the WaterSeal. This means you can adjust the fluid level easily and quickly. The unit has a new incorporated suction control bypass adapter. This provides quick conversion to alternate suction regulation with a thoracic wall regulator or portable suction pump. This allows the unit to achieve suction levels greater than -25 centimeters of water if required. The integrated handle and new improved rotational floor stand make the unit easy to carry and stable when positioned on the floor. The AquaSeal chest drainage unit also offers an automatic relief valve to prevent high positive pressure. A filtered manual relief valve that allows you to decrease negative pressure. Printed setup and operation instructions for quick, convenient reference. And double CSR wrap for presentation into the operating field. Now that we've looked at some of the features of the AquaSeal, let's see how simple it is to set up and operate the unit. First, you must fill the WaterSeal chamber. You do this by filling the pre-attached syringe to the top, raising the syringe above the AquaSeal, and letting the water flow into the WaterSeal chamber. As the water enters the chamber, it will turn blue, indicating the chamber is properly filled. Discard the syringe. Next, fill the suction control chamber to the level specified by the physician. Use the tethered cap to close the chamber. Remove and discard the cap from the patient connector and attach it to the patient's thoracic catheter. Close the black flow control valve on the suction port and connect it to the suction source. Turn on the vacuum and open the black valve until you see gentle bubbling in the suction control chamber. Place the AquaSeal as far below the patient as possible. You may hang it from the patient's bed or place it on the floor using the rotational floor stand. Make sure the patient drainage tube is straight and there are no dependent hanging loops. Because chest drainage is so important to your patient's recovery, you should make a point of checking the AquaSeal regularly to make sure it is working properly. The unit should be checked at the beginning of every shift and as necessary per the procedure requirements. Make sure that all tubes are straight and free of dependent loops. Listen for hissing sounds that might indicate leaks in the system itself. It's normal for the water level in the AquaSeal chamber to rise and fall as the patient breathes. This is called tidling. It will decrease as the patient's lungs re-expand. On the other hand, bubbling in the AquaSeal chamber may indicate a patient air leak, possibly pneumothorax, or a leak in the system. Talk to the patient too.
I'm feeling a lot better today.
Ask about any uneasiness or discomfort. Watch for signs of difficulty with respiration or the drainage process. Note the amount of drainage at the beginning of your shift. You can write this directly on the collection chamber of the AquaSeal. Note the time and initial the reading. In the early stages of drainage, you should take these readings every 30 or 60 minutes. Ask the physician what sort and amount of drainage to expect, and note anything unusual. For example, if the rate of drainage is increasing steadily or is greater than 100 milliliters per hour, notify the physician. If you need a sample of the drainage fluid, take it as close as possible to the patient's thoracic catheter. This fluid is most typical of the fluid being drained at that moment. Use a syringe with a needle no larger than a 20 gauge. You will find more detailed information in the printed instructions that come with the AquaSeal. Take time to read them before you operate the unit. Now let's talk about autotransfusion. For most patients, autologous blood is the best and safest choice for transfusion. It eliminates the chance of transmitting diseases like HIV or hepatitis. It minimizes the risk of transfusion reactions. It reduces the demand for banked blood. And as a result, it reduces hospital costs. With the AquaSeal chest drainage unit and autotransfusion system, blood is collected from the patient's mediastinal or pleural areas and reinfused. Collected blood must be reinfused within 6 hours. The AquaSeal autotransfusion system is designed to make this procedure simple, reliable, and safe. The Argyle autotransfusion accessory unit attaches to the AquaSeal chest drainage unit with a simple hook and Velcro design. This allows for easy removal and replacement during the collection and reinfusion process. The autotransfusion accessory unit has color-coded connectors to make it easy to set up. First, close the patient drainage tube clamp. Disconnect the interlocking connectors on the patient drainage tube. Connect the patient drainage tube to the autotransfusion accessory unit using the matching interlocking white connectors. Use the blue connectors to connect the autotransfusion accessory unit to the AquaSeal and open the patient drainage tube clamp. Blood will now collect in the autotransfusion accessory unit. Either gravity or continuous autotransfusion may be used to administer the blood back to the patient. To use gravity infusion, you should collect at least 250 milliliters of blood. 500 milliliters would be better. Close all clamps and disconnect the blue and white interlocking connectors. Reattach the patient drainage tube to the AquaSeal using the blue and white interlocking connectors. Reopen the patient drainage tube clamp. Connect the interlocking connectors on the autotransfusion accessory unit. Hang the bag as you would any standard blood bag. You must use a micro-aggregate filter when reinfusing autologous blood. Prime the filter and IV administration set according to the manufacturer's directions. A new filter should be used with each new reinfusion. Expel any remaining air from the auto transfusion accessory unit. Uncover the spike port and attach the filter and IV administration set. Connect to the patient's IV. Set the infusion rate as ordered by the physician and begin the infusion. A standard pressure infusion cuff may be used for rapid infusion of collected blood. Maximum pressure is 150 millimeters of mercury. To prevent air embolism from occurring, do not re-infuse below 50 cc's. The AquaSeal also provides you with the ability to do continuous auto transfusion. Again, a micro-aggregate filter and IV administration set are used according to the manufacturer's directions. Connect them to a blood-compatible infusion pump with an air in-line detector. Set the rate as directed by the physician and begin the infusion. The AquaSeal should remain below the level of the patient's chest. With either method of reinfusion, you can add anticoagulant as required through the auto transfusion accessory unit.
Yeah.
As you can see, the Argyle AquaSeal chest drainage unit and auto transfusion system meets the needs of the patient, the physician, and you, the healthcare professional. The Argyle AquaSeal chest drainage unit and auto transfusion system. Simple, safe, and effective.